Hello, my viewers of Doctor BMS channel, and welcome to today's edition in which I would like to talk about the Naltrexone implant. In the previous videos, I have talked about medical therapies that are used in rehabilitation, and I mentioned that when people come in for rehabilitation, we give them various medications for detoxification and for restoration of their health. We also give them medication for prevention of relapse into alcohol or drug addiction. And in this category of prevention of relapse into addiction, I mentioned the naltrexone implant. And this is what I would like to talk about today. So this is a packet of an Naltrexone implant that is available in our country today. There are various types available in markets all over the world, but all of them contain the Naltrexone tablet, which is used to prevent relapse into addiction to drugs and alcohol. And that's what I would like to talk to you briefly about so that you know how it works, and when you come and ask for it, you can benefit more from its use. At the Fountain of Hope Treatment Center, we receive patients who come with various kinds of addictions, and we classify the addictions into two types. The first is the chemical addictions, and the second is the behavioral addictions. Chemical addictions, this means someone is taking some biochemical substance or chemical substance like alcohol, like marijuana, smoking, like nicotine, cigarettes, like cocaine, heroin. Those are chemical substances which alter the functioning of our brains and cause addiction. But we also have the behavioral addictions where people are addicted to certain behaviors that are harmful to them, like gambling, like sex addiction. We even have shopping addiction. We have all sorts of behaviors which can become addictive and lead someone to require rehabilitation therapy. So, particularly for chemical addictions, alcohol, and the drugs of addiction that we know of, when they come and we have gone through the detoxification treatment, we have restored their health, we have taken them through counseling and psychological therapies, we also may want to give medical therapies to prevent relapse into addiction when they leave the center. And this is where the naltrexone comes in as part of the multi-approach treatment I've just mentioned that encompasses both psychological techniques, counseling techniques, and medical techniques. So specifically with naltrexone implantation, when someone comes into rehabilitation and we plan to give them the implant, we first start by preparing them, and the preparation starts with the detoxification process where someone who's come into rehabilitation may be actively using. Some of them can even come still drunk from alcohol or from smoking marijuana or the drug of addiction. So we have to detoxify their bodies, remove the intoxicant, the drug of abuse from their bodies, and to prevent withdrawal symptoms which normally develop if they do not use their drug of choice on a regular basis because they are used to. And this process of detoxification clears the body of the drug and makes it able to receive other therapies, particularly the implant, the naltrexone implant. So that's the first step, that we detoxify the person. We make their body to be clean again. The second is that we restore the health of their bodies as much as possible. This is through nutritional support and replacement of nutrients that they may be lacking, treatment of diseases that they may be having accompanying their alcohol use or their drugs of addiction use. And we then go to the third stage of preparation, where we prepare them psychologically through counseling and other psychological or psychotherapeutic techniques, so that this person then becomes a willing participant in the rehabilitation. They become motivated and determined to stay clean. This is an important step, so that when we finally give them the implant, they'll work in collaboration with the implant, as opposed to working at cross purposes with the implant, because probably they still want to go back into addiction. And once they have been prepared sufficiently, usually over the 3 months period that they stay in rehabilitation, they are now ready, just before they leave, for the insertion of the implant. And the implant is in the form of a tablet, which is inserted in the body. We have another tablet variant, which is taken by mouth, the way we use tablets for other treatments. But this particular one is inserted under the skin, and this is a minor surgical procedure that is done by a doctor or a qualified medical personnel. And when you come for the insertion, we take you into our theater. We prepare an area of your skin on the side of your lower tummy, and we numb the place using local anesthesia, just like it's numbed when you have cut yourself and the doctor is stitching you or repairing a wound or a cut. So we numb the area that we have prepared. We make a small cut on the skin, about a centimeter or 2 centimeters, and we create a space between the skin and the underlying tissues by creating a small tunnel, in which then we introduce the tablets, and we close the wound we have created, leaving the tablet under your skin, from where then the tablet is going to be absorbed slowly over time, over a period of 3 months, during which it is effective. And it's absorbed in small quantities every day to act on your body and prevent you from having the desire, the cravings for alcohol and for drugs of addiction. Because how this tablet implant works, as well as the oral tablets, the ones you take by mouth, how they work is that when you take them into your body, they go and mix with the blood and circulate up to the brain, and they block or they stop the centers of your brain which feel enjoyment from alcohol or drugs of addiction. And so if you take alcohol, marijuana, or other drugs of addiction you are used to, then you do not derive the enjoyment you are used to, and then you give up because you went there to take them to have the enjoyment in the first place. So if there's no enjoyment, then there's no need using it. And this is why it's important that we give them to someone who is motivated to change, who has gone through the other treatments, the multi-treatment approach that I talked about, so that this person then has this drug helping them in their new intention, in their new motivation. And if they ever came across a temptation where they relapsed or slipped one day by accident and took alcohol again, they don't derive the enjoyment that they were used to, and they quickly can go back to their new way of not drinking, of abstinence. And so this is how the drug is active in the body after it has been inserted. Then from the insertion, we let you go home, and a week or so later, we require you to come back to our clinic so that we check the wound, we remove the stitches that we used to close the area we had cut to use to insert the tablets, and check the wound is healed and let you go. During the time also, we teach you how to take care of this wound, dressing it yourself just by cleaning with spirit and dressing it with a small bandage or with a elastoplast, because it's a really small wound that we have created in the body. And when it is sufficiently healed, then we let you live your life. The drug is active for 3 months, during which time we know that with the motivation you have, the desire you have developed in rehabilitation center to change, you'll have found new ways of spending your free time so that you do not go back to drinking and using drugs of recreation as a pastime. You will have formed new friends so that you leave your old friends you are drinking with and form new friends who do not encourage you to drink. And therefore, this drug then protects you, gives you an extra protection during a transition period where you are changing from a life of recreational drug use to a life of no drug use, acquiring new habits, new hobbies, new friends, new way of thinking, interaction, and spending your free time. And at the end of the 3 months, most of the people do not need the drug anymore because they have changed their lives wholesomely. A few people may require that we give another implant so that we extend the period for another 3 months, and we ensure that they are completely okay. So during this time of follow-up after surgery, we are also checking to see that the drug is not only working well, but you remain motivated and you are changing your lifestyle wholesomely to be commensurate with the lifestyle of someone who is not using recreational drug. This is what we call the aftercare or the after rehab program, where we keep close contact with our patients out there. We support them, we link them to positive support groups like Alcoholic Anonymous, Narcotics Anonymous, and various such groupings that support people socially to remain on the path of soberness and abstinence from use of drugs. Some people ask about the side effects of this drug, of the implant when it is inserted. The implant, as well as the tablet form of the implant, which you take by mouth, because the implant is also a tablet. So the oral and the implant form, they generally are well tolerated by users. They don't have many side effects. In fact, From my experience as Doctor BMS, inserting these implants every week at our center, we have characterized that only about 2 out of 10 people experience some side effects, and these are usually minor side effects. Some may experience some nausea and vomiting if they are taking the tablets by mouth. They may experience some muscle pain as the drug starts to dissolve in the system and circulate. For those who have gotten the implant, some may experience some pain at the place that we inserted uh, the tablet, which is normal because we have cut. And these are generally the common side effects that we see. A few other people rarely will complain of other side effects like they have anxiety, they feel a bit depressed. We think this probably because of the adjustment to a new lifestyle and having to change everything that they were doing to a new way. Some complain of having a high sexual drive or a low sexual drive when they have used this drug. It varies. And we monitor these patients also so that we do not have this side effect of affecting the liver, because the drug is removed from the body through the liver. And so in patients who have liver problems, remember alcoholics may have liver cirrhosis or liver disease, so such patients may get some little side effects to do with the liver. So we check also that this does not happen during the follow-up stage after we have inserted. But generally of importance is that the drug is well tolerated and it works well and gives you the protection to remain strong on your new path of soberness or non-alcohol, non-drug use. Lastly, I would like to mention that when you have this implant, there are some important things you need to remember as things you need to do and things you do not need to do. For the things that you need to do, remember that you have made a decision to quit your drug use ways, your alcohol use ways, and you need to remain steadfast on that path and not waver. So do not see the drug as coming to substitute your willpower. You need to remain motivated and to seek to walk that new path. Perhaps that's the most important thing you should do all the time. So therefore, do not go out and tempt the drug. I use this terminology of tempting the drug all the time when I'm giving advice to my patients. Do not feel that now I have this drug, I can go and test it. I can just go and drink, it will protect me. No, you will not be doing the right thing, because if you do that, then you are undermining the very process that started in rehabilitation, the change process, but also you will be causing yourself to have a likelihood to develop a side effect, which I didn't mention and I want to mention it now, that this drug, if you remember, it blocks the parts of the brain that feel enjoyment from drugs, from alcohol. And so if you go out and drink and use recreational drugs again when you have the implant, what may happen is that because you are not feeling the enjoyment since the drug has blocked it, you run a risk of overdosing yourself by trying to take more, to smoke more, looking for that enjoyment which is not going to come. And so as you continue to take more, just hoping that the next bottle will give you the enjoyment, you can precipitate an overdose. The other side effect that can come is that because the pleasure centers have been blocked, this means that the rate at which the drug is going to be used up by the body is slowed down, and so your body can become more susceptible to the effects of the drug, so you get drunk faster because a lot of it is theoretically available. But because it's blocked and you're not going to feel that drunkenness, so the toxicity or the accumulation of the drug in the system will manifest in other ways, like alcohol poisoning or acute intoxication, where you find a lot of alcohol is in the body and the body cannot sustain it, and you go into a depressed state, the coma state, the blackout state that I mentioned when I was discussing the effects of alcohol on the body. This can happen to you even when you're feeling that you are not drunk, because the drunk feeling or the high feeling from drugs has been blocked, and you're not aware that this has happened. You're just plowing on until you reach that catastrophic end. I would like to stop there so that I let you make a decision then, that when you come to seek rehabilitation services, you can get this wholesome care where not only are you rehabilitated in the body, but also in the mind and in the spirit by a combination of these multi-approach treatments that I have discussed, including the Naltrexone implant. Thank you, and see you again in the next video.